Hi, my name is Kayla Toulis, and I'll be talking about securing electronic health records. So, the histories of EHRs is before the 1990s, when EHRs really started to become popular. Patient medical records were kept on paper and in a file system or a file room. And in the 1960s is when the earliest EHR was created, but it mainly focused on processing clinical data, not actually patient records. And then in 1972, the first EHR was developed, but it wasn't widely used because it came at a high cost and the internet wasn't readily available. So that's why in the 1990s, when the internet became more readily available and more accessible, that's when clinicians started using more personal computers. And the idea of actually storing patient records and data electronically was seen as a possibility, and more people were more in favor of it and more in favor of change. And then in 1991, the Institute of Medicine saw the benefit of EHRs and made the case that by year 2000, each doctor's office should be using computers in their practice to help improve patient care. Then came along HIPAA, which is the Health Insurance Portability and Accountability Act. And this was introduced to make sure that disclosure and confidentiality regulations are followed when it comes to electronic patient information. So this is to make sure that hospitals and healthcare organizations aren't just giving away patient health information. And this is making sure that they are regulated at a federal level. So the benefit of EHRs are that it can improve patient care, increase patient participation, improve care coordination, improve diagnostics, improve patient outcomes. It's cost efficient and it's time efficient. Now, when it comes to EHRs, anything electronic, of course, has the possibility of being breached and being hacked. And so that does not stop with EHRs. That is definitely a possibility, and it has happened. And not only has financial and reputational effects on the healthcare organization, but the effects can be severe for the patient as well because of the information that is accessed. So in 2013, there was 804 major data breaches affecting over 29.2 million patient records. So since then, the past 5 years, the popularity of EHRs have increased, but the evolution of cybersecurity behind the EHRs hasn't really evolved the same. So then became the HITECH Act, which is introduced to outline a specific protocol that must be followed when reporting a data breach. So for example, if a data breach affects more than 500 patients, the HITECH Act requires that the hospital provide specific details about the breach in a specific manner. And this holds the hospital accountable or the healthcare organization accountable for reporting these breaches. And then the adoption of EHRs. So the government actually ended up putting an incentive to anyone who adopted the EHR before 2015, but then ended up giving penalties to anyone who had not implemented them by 2017. So with this increase, cybersecurity, of course, needed to go hand in hand with the evolution of the EHR. And then we needed to use certain security techniques to make sure these patient records were secure. So the three things we're going to talk about is physical, technical, and administrative. So first we're going to talk about administrative. So the first thing you can do is conduct audits, and that means conduct audits on patient records. That means looking at the audit trail for the actual EHR. Hiring a CISO, so a Chief Information Security Officer, because this is the person that will solely be responsible for making sure the information is secure in the organization. Now also designing a contingency plan, because everything is possible, and a data breach, regardless of everything that we have in place, is still possible. So we need to make sure we have contingency plans so employees know what to do in case of a data breach. Now, physical techniques could be assigned security responsibilities, workstation security, and physical access controls. And this is important because it is actually the second most common cause of a security breach. So you want to make sure you assign security responsibilities because of the security officers that are actually on foot there. You need to make sure that they are correctly going around the institution to make sure everything is secure and safe. We need workstation security to make sure that when people walk away from their workstation, and the session goes idle for long enough that the workstation actually locks, and it makes them log back in, that no one can come behind them and just access the system. And then we need physical access controls because of the server rooms and everything that may still be on site. We need to make sure those are have control, that are controlled, that access is controlled, more than likely on a role basis of who can access those certain rooms. And now we have technical. So technically behind it, we can use firewalls such as packet filtering, which is a firewall technique that's used to control a network by monitoring outgoing and incoming packets and allowing them to pass based on the source and destination IP address, protocols, and ports. So if something is off, it'll actually block that packet from entering and then from infecting our system. We could also put a stateful firewall, and that tracks the operating state and characteristics of a network, and it'll only allow packets matching a known active connection to pass through the firewall. We can also do an application level gateway, which is a firewall proxy which filters incoming node traffic to certain specifications, meaning that only transmitted network application is filtered. Then we can use a network address translator, which is a method of remapping an IP address space into another by modifying the IP address. So, to a certain extent, it's kind of a VPN. And those firewalls all together would be very strong in securing an EHR. Firewalls are definitely seen as costly, but when you do a risk assessment, the benefits absolutely outweigh the risk and the cost. Then we have cryptography. So encryption when the data is being transferred, especially using mobile devices, because now mobile devices in a healthcare organization is becoming very popular. And so when they're using the mobile device, it's transferring to the EHR, and we need to make sure that that data is encrypted while being transferred. And also encryption and decryption when patient records are being accessed. So when it's being accessed, we need to decrypt it, and when it is not being accessed anymore, we make sure it is encrypted again so it is safe. Also, we must track the information created, received, maintained, and transmitted within the network. And this can be used for audits. We need to make sure we have that information. So if anything also happens, we can go back and we can try to see where that happened. And another thing that is very simple is usernames and passwords on role-based access control. So we have username and passwords, and based on that, that person will have a certain role, and based on that, they'll have access to certain information inside the EHR, and will only be able to conduct and see certain information, and only conduct certain actions within the EHR. So we need to make sure we have those usernames and passwords and that role-based access. We can also, of course, add antivirus software to the EHR, and also using RFID card. A lot of times hospitals actually are using this now, and it's seen as a benefit because at the workstation, nurses and doctors are just using the RFID card to sign in and sign out of the EHR and of the computer. So these are definitely technical ways to make sure that these EHRs are safe. Now, closing, with the advancement of technology in healthcare, we've created many things that have changed and saved people's lives. But with these advancements, of course, some type of weakness comes with it. And with these EHRs, the weakness I see is the security behind it. But if we use the correct controls and put them in place, it'll secure the information and everyone's mind can be at ease because we know that this system is secure and locked and we can trust it. And you can do that by using the techniques that I talked about in this presentation. So thank you for listening.